स्टार्ट करो मैडम, स्टार्ट।
Hello everyone, I am Jabji and welcome back to Aditya Birla Health Insurance Health from Home series. COVID-19 has changed our lives completely. It's been more than a year now. But yes, the good news is that we now have a ray of hope. The much awaited vaccination is here. I believe it is really a very positive news for all of us. We can now bounce back to life with a much healthier version of ourselves. But yes, the vaccination brings with it a lot of doubts and questions to our mind. लेना safe है? अगर कोई pre-existing disease है, तो vaccination के side effects क्या हो सकते हैं? While there is hope, there is a bit of nervousness. Like I see a mix of emotions around me. कुछ लोग हैं जो बहुत positive है, but कहीं doubts हैं. तो आज हमारे साथ है डॉक्टर निकिता, a wellness coach from Aditya Birla Health Insurance. She will help us clear our doubts and answer the important questions that we have about the vaccination. A very warm welcome to you, Dr. Nikkita.
Hi, Jabji. Thanks for having me. Hi to everyone watching this. I totally understand that a lot of people would be anxious and have queries regarding the vaccine. We as health coaches also get a lot of questions from our customers and their family members about the vaccination, especially now that we are in our second phase. And I'm glad to help address these questions.
Thank you so much, Dr. Nikkita, for joining us. Viewers, you can also post your doubts and queries in the comment section related to the vaccination, and we will take as many questions as possible. So, Doctor, let's begin.
Sure.
Yeah. So, one of the questions that's top of our minds is that these vaccinations have been introduced in a very short span of time. Everyone's wondering, how safe are these vaccines? What are your views about it?
So, Jabji, everything novel does create some amount of hesitancy, doubts, fear. This is very common and it's global. This is because of a lot of misinformation and rumors being circulated. And, usually vaccines are introduced in the country only after the drug regulatory bodies clear it post looking into the safety and efficacy data of the vaccine. So all the licensed COVID-19 vaccines will have comparable safety and efficacy.
That's good to hear. So does everyone have to take the vaccination? Is it mandatory?
So what we know is that in the past 1 year, COVID-19 has changed a lot of people's lives, causing serious illness and death for a lot of people as well. So here where the vaccine actually plays a role, to help protect those who are especially at a higher risk. So coming back to the question, as of now, the COVID-19 vaccination is voluntary, meaning you can get vaccinated if you wish to do so. However, it is advisable to get yourselves and your loved ones vaccinated when it's your turn. And the most important thing is to receive the complete schedule, that is both the doses. This will help develop some degree of immunity and prevent surge in cases by limiting the spread of the disease.
Yeah. So what about people who had COVID-19? Do they also have to necessarily get vaccinated?
So individuals who are currently infected by COVID-19 should defer taking the vaccine for at least 14 days post their symptoms resolution. They can get vaccinated after that. This is just so that they do not increase the risk of spreading the virus to others at the vaccination center. And irrespective of your past history or infections, it is advisable to receive both the doses of the vaccine because it will eventually help the individual develop a strong immune response.
That's good advice. What are the currently available vaccinations in India?
Currently, there are 2 COVID-19 vaccines which have been approved in India and is being used for administration. One is by the Serum Institute of India, the AstraZeneca vaccine, which is also known as Covishield. And the second vaccine is the Covaxin, which is produced by Bharat Biotech.
Okay. But another question that pops up mostly is that how effective are these vaccinations if we compare it to other countries?
So India as a country is not far behind anyone, in terms of research or in terms of vaccine development. In fact, India has one of the largest immunization drive in terms of vaccinating pregnant women and children in the country. So talking about the COVID-19 vaccine, it has undergone various phases of vaccine trials to ensure its safety and efficacy. So the vaccine that is introduced in India is effective as any vaccine developed by other countries.
Okay, that's great. So two vaccines available and both are equally good.
Yes.
So how do you decide on which one to go for? Is it availability or what? What in your view?
Like I said, there are two vaccines which are being used for administration. The vaccines are cleared by the drug regulators post studying the safety and efficacy data from the clinical trials. One we must ensure is that for the vaccine to be effective, you must receive both the doses of the vaccine. The second dose is usually given 28 days post the first dose. And secondly, you must complete the vaccination schedule by only one type of vaccine. Like, do not mix the vaccines. Like the idea, like what I'm trying to explain is that, since during the first dose, there's an antigenic stimulation, and you should take the same vaccine in the second dose so that your body's immune system gets triggered.
Okay, that's an important piece of information, I think, that it's important to go with the schedule and not to mix it. Also, another is that there is a certain temperature at which vaccination. Do you think India has the capacity at 2 degrees and 8 degrees and transport them as required? Also, considering that we are entering the summer season now.
Right. So India runs one of the largest immunization programs in the world, catering to vaccination needs of more than 26 million newborns and 29 million pregnant women. So the program mechanisms are being strengthened up effectively to cater to the country's large and diverse population. So we definitely do have the capacity to store COVID-19 vaccines.
All right. And how do you go about registering yourself? How can I go register myself? Who is eligible today?
So I'll let me explain how the registration can be done. Um, so the registration can be done on the COVID 2.0 portal or the Arogya Setu app. You can register with the things that you require for registration is one is a valid mobile number, and secondly a valid photo ID. And when a person registers, he can register for himself and a maximum of 3 people for the vaccination. So once you register, you can log in with your mobile number and you will receive an OTP. Fill in all the necessary details and select the identity proof from the drop down. One thing you must remember is when you visit the vaccination center, you will have to carry the same photo ID that you had selected while registering. You can also then schedule your vaccination based on available time slots and near your vaccination center. You also have the option of rescheduling. So once you have confirmed your appointment, you can download the confirmation and you will also receive an SMS regarding your appointment on the registered mobile number. Individuals between the ages of 45 to 59 who have comorbidities, that is, people with hypertension or diabetes or any heart diseases, will need a certification from a registered medical practitioner to be eligible for the vaccination, which they will have to carry when they go to the vaccination center. And once you're vaccinated by the first dose, the citizens will be automatically scheduled for the second dose, that is 28 days later after receiving the first dose.
All right. And you mentioned about a doctor's certificate. So are there prescribed some doctors that we need to go with, certain centers we need to visit for that, or we could go to a general practitioner or a regular doctor for that?
So my advice would be that to visit your own physician or your family physician, because he's the one who knows your condition. You can visit him, get yourself checked, and he can certify you for the vaccination.
Okay. And regarding the documents, like you mentioned, it is a valid photo ID that is needed. Apart from that, anything else that somebody needs to carry for registration purposes?
One is, yes, definitely the photo ID. And like I said, for individuals between the age of 45 to 59, it is their certificate from their registered medical practitioner. They will have to carry those two documents with them.
Right. So, how do you think, doctor, someone who's the beneficiary can receive information about the due date of vaccination? And how do you get to know about the status of the vaccination? It's like, when is the due date and what's the status? What's the record that one needs to go with?
So, Jabji, following the online registration, the individual will receive an SMS on their registered mobile number, and also the date, the place, and the time of vaccination. And once both the doses of the vaccine are administered, he will receive a QR code based certificate, which will also be sent to their registered mobile number. And so for everyone, like, please keep the certificate and the SMS intact. You will need it further on, like as an additional document if you ever travel or you need to go to certain places.
All right. So, it brings me to a very, very important question. And many of us, including myself, I have that doubt. So, we are all a lot worried about what are the side effects of these vaccines, and what are the possible measures we need to take to ensure that we don't catch on to those? Are there ways to avoid those side effects?
So, side effects that one might experience, which are common even when you take like any other vaccine, that could be like slight pain on the site of the injection, mild fever, uh, tiredness. This is just a normal sign that your body is building protection. Okay, and this should go away in a few days. The CDC has also listed three other side effects which may be noticed, that is rashes, muscle pain, and nausea. And not necessarily that everyone will experience these symptoms, though. Things that to keep in mind when you go for the vaccine is you must take rest at the vaccination center for at least half an hour post taking the vaccine. And second is, in case of any discomfort or uneasiness, like, inform the nearest health authority about it.
All right. And post vaccination, in how many days or weeks do antibodies develop to fight the disease?
So let me help you understand this. When you receive the first dose of the vaccine, this will interact with your immune system. And when you get the second dose, your immune system has memory cells, which will identify and reinforce this. This will help activate your immune system. And usually, protective levels of antibodies are developed 2 weeks post receiving the second dose of the vaccine.
All right. So 2 weeks is what we need to watch for. So even after taking the vaccination, is one prone to COVID-19?
See, the vaccine will help develop your immune response. However, you will have to be alert since coronavirus is still there. And so, people, please continue to follow the COVID-19 guidelines. Wear a mask, maintain social distance, wash your hands regularly.
Okay, so while vaccination is important, I think it's important to also stay safe and protected. Which is a very important tip, I think, from the doctor. So, how doctor?
Yes, Judgy.
Yeah. So our viewers are pointing out some interesting questions. One of the questions is, how will I know when my turn will come for the vaccination?
Right. So the thing is that, like we know that the vaccination drive had started on in January with the frontline workers and the health workers. And now currently from March 1st onwards, we are in our second phase, which is for citizens above 60 years of age, and for citizens 45 years, in between 45 years to 59 years, with comorbidities. So whenever it is your turn, when you are eligible to get vaccinated, you will be informed through an SMS, and the government will announce who is the next category to be receiving these vaccinations.
Okay. Another important question, and I relate with it. I'm scared to take my parents for vaccination. Is it important to take them?
Yes, if right now, if your parents are falling in the category, and you should take them, because like I said previously as well, that you know we were all waiting for the vaccine, and now it is here. It gives you some immune protection, so it's better than catching the virus than taking the vaccine. So it might as well get the vaccine given to your parents.
Yeah. I think it's important for all of us to now start taking the vaccination. Uh, and another question from our viewers is, does the second vaccine have to be taken on the day that they have been blocked? Is it important to go that very same day, or it can be around that time?
So it can be around that time if you're not able to go for the second dose on the date that is mentioned. But see to it that 4 weeks post your first dose, you do go and get your second dose of vaccination.
Okay. And people with cancer, diabetes, can they also go and take the vaccination?
Yes, so people who have a number of health conditions are at a higher risk, of serious illness. So here, the benefits outweigh the risk. So it is advisable to get yourself vaccinated. Definitely consult your physician first, get his advice, and then you can go ahead with the vaccination.
Also, another one goes that there is news floating around on the choice of two vaccination, and whether one should stick to the one made by Serum as against the one made by Bharat. Is there any merit in this, or either can be used? I think you answered, but if you could come back on this.
Yeah. So, like I said, see, vaccines are usually a lot of data is studied by the drug regulators about their safety and efficacy, and that's how it's introduced. So, either taking a Covishield or a Covaxin is safe, because after research, this has been approved by the government of India to be administered for the citizens of the country. So either vaccine is fine. But just remember, whichever vaccine you have taken first, to take the second dose of the same vaccine.
Okay. And how can one know about the centers, where to go for these vaccinations? Are they available somewhere? Can they visit a website?
Yes, so when you're registering for your COVID vaccination, you can go to the covin.gov.in site, and when you register there, you will also find the list of vaccination centers, um, and you can go to your nearest vaccination center and get yourself vaccinated.
All right. And are there any documentation that are provided after taking the vaccination? Any documents or any certificate that is given to the person who takes the vaccination?
So, like I said, after your first dose, you will receive an SMS about your vaccination and when you are due for the second vaccination. And once you complete the second dose of the vaccination, you will receive a, QR code certificate. You'll receive it on your registered mobile number. You can take a printout of that. So that is a document that shows that you had received both the schedules of the vaccination. And like I said, keep that with you, because whenever required, you can always show it.
Also, doctor, in how many days after you register does the turn come? Like, in how many days would you be called for the vaccination after registering?
So on the site itself, you can select, your registered preferred date. Time slots are given, dates are available. So as and when you are ready, you can register for it, and you can go to the vaccination center and receive the doses.
All right. Uh, is it any possibility to get the vaccination without registering? It's like you decide one day, you go, and is that possible for now?
No, so they've streamlined it pretty much, where you because our we have a vast population. They need to reach out to people in the urban and the rural areas. So that's why they have made this process of registering yourself first and then going and getting your vaccination. So and it's better to register and not face any hassles when you visit a vaccination center.
Yeah, that's right. And if you happen to miss your appointment, is it possible to reschedule, or you have to again go through the long process of registering your Aadhaar card or a PAN card, etc.? So, what's the process in case you happen to miss a dose, or a date basically for the vaccination?
So no, you don't. You will not have to go through the entire process again. You can reschedule in case you are not available on that given day to go and get the vaccination. You can go and reschedule on the website or even on the Arogya Setu app, since you can register there also. Wherever it is, you can go and reschedule your appointment.
Okay. Also, doctor, are there any dietary, nutrition related tips that you would want to give to our viewers, or any particular diet they should follow before they actually register themselves and go for the vaccination?
So there is no particular diet as such. Just eat healthy, stay active, and if visit your doctor prior to getting yourself vaccinated for the ones who do have comorbidities. Like I said, the ones who have diabetes and hypertension, um, and practice social distancing even at the center. wear your mask. After you get vaccinated, stay there for at least half an hour just to see that, just so that they can monitor you if, for any side effects. And I think then you're good to go.
Yeah. So also, doctor, we all started building our immunities as COVID happened, and we've been all continuing to do so. Any tips from you that is after we get a vaccination shot, is it still important to take all the vitamins that we've been taking and uh, go with the same sort of process and flow of maintaining health?
So, like they say, health is wealth, and so you still continue, eating healthy. And I think this COVID times has taught us that how important health is. So, continue with your regular medications. Build up a healthy lifestyle. Exercise regularly. At least take out time, 5 days a week, 30 minutes of any kind of activity, whether it's walking, jogging, Zumba or yoga. So continue with your exercise and healthy eating. And since coronavirus is still around, continue to practice social distancing and the COVID-19 guidelines, because we are going in phases for this vaccination. So right now, not everyone is eligible for it. So as and when your turn comes, definitely do go and get yourself vaccinated.
Thank you so much, doctor. Uh, we would like to thank all our viewers today for joining us. I hope we've answered all your queries. In case you have any queries, please doctor. So, guys, whoever is eligible today, please go ahead and take the vaccination and take the right precautions needed. Let's work together towards making our country COVID-19 free. Thank you so much for watching. Home.
Thanks, Trabji.
It was a pleasure having you here, doctor.